To strengthen our university's efforts to foster an inclusive and equitable environment for all of our students, faculty, and staff. This summer's racism-related tragedies have sparked much-needed conversation in academia and beyond. And I'm really proud to be part of these conversations at the university level with the other unit diversity officers, but also closer to home as the chair of the SUN Diversity and Inclusion Committee. Therefore, it's really my pleasure on behalf of the Diversity and Inclusion Committee to welcome you to the first of a variety of exciting events that we have planned for the academic year that will bring issues of justice, equity, diversity, and inclusion to the forefront of ongoing conversations in nursing. A discussion about professional challenges with race in nursing brings together 5 practicing nurses, hopefully 4 right now, tonight, who have generously volunteered to answer audience questions about their experiences as Black nurses. This event was inspired by conversations we had with nursing students this summer about racism and the gaps they perceived in our nursing programs, including a lack of diverse role models. We intend this event to be very conversational, so we're hoping that many of you have questions to pose to our panel. And I'm really pleased to say that we have several interesting questions that were already posed by students prior to the event, and those will be addressed tonight, along with others that you hopefully have for our panel. One comment that was submitted earlier in particular caught my attention. Someone asked why we use the term race in our title rather than racism. I want to acknowledge, honestly, outright, this is an excellent point. And again, it speaks to the importance of having ongoing conversations about these topics so that we can learn from one another and grow. Language is so very important, and each of us has so much to learn from one another in order to create spaces where we can begin to address racism and related microaggressions that plague our social interactions. So I really hope that this conversation tonight can help in some small way to move us towards that goal. Before I pass the torch along to Grace Gerass, who's content developer in our Office of Donor and Alumni Communications and the moderator, I'd like to extend a few quick thanks. First, to the nursing students who provided really candid feedback that has helped guide our efforts to strengthen our programs, including serving as inspiration for this event tonight. Second, and probably most obviously, a big thanks to our panelists who've made this event possible. The event also would not have been possible without the teamwork of the Diversity and Inclusion Mentoring Subcommittee, which included myself, Meg Dorsbacher, Sarah Goldwright, Grace Gerass, Kaffi Agbemenyu, and Stephanie Comer. And finally, I'd like to extend thanks to the Gamma Kappa chapter of Sigma Beta Tau International for co-sponsoring this event tonight. So welcome, everyone. I'm going to hand it over to you, Grace.
All right, thank you for the introduction, Amy. So I am recently joined to the School of Nursing as the Assistant Director of Communications and Alumni Engagements. I'm so happy to be here moderating today. But before we jump into today's discussion, I'd just like to cover a few housekeeping items. So please take this opportunity to mute yourself if you haven't already. We're asking everyone to please stay muted throughout the conversation until you're speaking, just so we can avoid any audio issues. Also, we know that a lot of people would like to receive these updates and hear about these kind of conversations, but can't join us here today. So please know that we are recording this discussion to be shared at a later date, and we also plan on sharing this with our members over at Sigma. So in terms of an agenda, we're going to begin today's discussion with a few of those pre-submitted questions for our panelists, and then we're going to open it up for some audience Q&A. So if you have any questions throughout this discussion, please feel free to post them directly in the chat box and we will make sure to get to them. If we do not have time to get to every question, we will follow up with panelists and make sure that you receive answers within the next week or so. So please feel free to put them in there and we will make sure we get to them. Now, so I'd like to ask each of our panelists to briefly introduce themselves. So Willa Arnett, will you please kick off your introduction? Willa, I believe you're muted.
There we go. I am Dr. Willa Arnett June, and I am an adult health nurse practitioner. I started my career at Duville, where I obtained my bachelor's degree, and then later went to UB for my master's and doctoral level. My experience has been from rapid response team at Buffalo General Hospital to doing long-term care from Machias to Gowanda Nursing Home to Inner City Deaconess, High Point. I've also done some home care as well. And I'm currently starting my own practice doing home care, seeing patients who are homebound. I've been a nurse practitioner for about 22 years.
Wonderful. Thank you so much, Willa. Tineka Pace, will you please introduce yourself next?
Sure. Good afternoon, everyone. I'm Tineka Pace, and I am a 1997 graduate of UB's African American Studies program and a 2002 graduate of UB's School of Nursing. I am currently working as a medical team lead at Travelers Insurance, working with workers' compensation. And prior to that, I was a medical manager for a cardiac unit in both Kaleida Health as well as Sisters of Charity, St. Joe's. I am a member of Black Nurses Rock and also very actively involved in recruitment with UB through their School of Management.
Great, thank you and welcome.
Thank you for having me.
Of course. Now, Shadivia Marshall, can you please tell us a bit about yourself?
Hello, everyone. My name is Shadivia, and I've been a nurse for about a little over 15 years now. My background is in med-surg, ICU. I spent a lot of time in long-term care and management as well. And I currently work for Travelers as a medical consultant, where I give my medical nursing opinion all day long, and I absolutely love it.
Great, thank you, Shadivia. And next, can we hear from Sophia Overton?
Hello, everyone. I am Sophia Overton. I earned my associate's degree at NCCC. I went to Damon and received my bachelor's and master's in nursing education. My background is anywhere from long-term care, corrections, hospice, diabetes education, and I'm currently a clinical nurse educator with Catholic Medical Partners.
Great, thank you.
And an adjunct with UB.
Wonderful, thank you. And then last but not least, can you please introduce yourself, Tyree Smith?
Hey everybody, how's it going? Can you hear me okay?
Yes, we can.
Okay, yeah. I'm talking off an iPad, so I know like the mute, the mic is at the bottom. So I'm Tyree Smith. I currently work at UCMC. As far as for like my background, I started at the VA hospital on a telemetry med-surg floor. And then after I did a year there, I worked at Roswell in a step-down ICU. And then I did like a cross-training for ICU. And I'm also like a member of the Navy Reserves. That's why if you see me today, I don't really have like my facial hair. I had to shave and everything. So, and that's pretty much it. I did my associates at NCCC and then my bachelor's at Damon, and I'm currently in the nurse practitioner program at Damon as well.
Great, thank you. And welcome to each of our panelists. So before we start the conversation, I would like to welcome our Student Diversity and Inclusion member, Stephanie Comer. Stephanie, can you please introduce yourself and kick off our conversation with your question?
Hi, so I'm Stephanie Comer. I'm a nursing student too. In the regular traditional program. I graduate in 2021, excuse me. So the first question that I have is, when did you initially realize that you were Black when it pertained to nursing, whether it be with patients, peers, or professors? Just kind of like that first move that made you starkly realize.
Any of our panelists can feel free to jump in.
You know, I can't say when the actual first moment was that it hit me. I can say when I did home care, I would arrive at a patient's home and sometimes they didn't let me in when they realized that I was Black. Or they would assume that I was the aide that was coming to assist them. And when I told them I was a nurse, they were pretty shocked. And some of them said, well, how did you manage that? You know, how did you get that? Where did you go? You know, that kind of a thing. And sometimes it's that way too. When I first started at one organization, we were in line to get our badges. And she passed out all the badges to the the nurses in the line. And she skipped me and the girl that was behind me who was also Black. And so we said, well, is there a reason why we can't have our badge? And she said, well, these are for the nurses only. These are not for the CNAs. So those are my realizations that hit me in the gut.
I would say I started out at Columbus Hospital. It's no longer there.
Mm-hmm.
But there, I didn't really pay attention to the fact that I was Black because it was a very diverse group of staff. Like there was a lot of Black RNs, Hispanics. So I didn't really notice it there. But when I transferred to Buffalo General Hospital, at the time, I don't think there was one Black nurse manager or any type of other ethnic group than the majority of Caucasian. And even on the units, there were very few RNs there. And it was difficult to try to get to other departments. And that was one of the main reasons why I decided to go back to school, because I couldn't really get to, I wanted to go to the emergency room department. And there was always a reason why I couldn't, get a different position. So I think that, and also as a nurse practitioner, it was interesting because my first job was with a Jewish doctor, and I wasn't aware of this, but I was going to Machias Nursing Home, east of Aurora Park Nursing Home, and when I would write an order, they would call him and question me to him, and he said, he told me, he said that if she writes an order, you do it. He was a Jewish doctor, so we both experienced discrimination. We had a patient that wouldn't see me because I was Black, and she wouldn't see him because he was Jewish, so she just never got seen. But yeah.
I started off in nursing as a CNA, so I did think that when I got my RN, it would be different. And I got my rude awakening on day one. I started off as an RN at Millard Fillmore Gates. I know nowadays you guys know Millard Fillmore Suburban. There used to be a Gates Hospital here in the city of Buffalo. And my preceptor actually told me she knew I wasn't here because I cared about people and I was only here for the money. And she told me she didn't expect a lot out of me. And that was the moment where it was like, oh, okay, I'm definitely being treated differently from the other girl who started on the floor with me. And that was on day one on the floor. As far as just realizing you're Black, and definitely I've experienced all the things the other nurses talked about, patients who automatically assume you're the aide, and when you tell them that you're not, they'd rather deal with the aide anyway. And definitely other nurses who just don't have that respect for you and for what you've done because you're the only one on the floor that's not Caucasian. Those have been my experiences.
I would like to just kind of preface my answer with saying, I grew up in the 1970s and I grew up in Cheektowaga and went to Union East elementary school, where I was the only Black person as far as I could see for a very long time. So I was very self-aware of what being the only felt like. And I think I just kind of grew up in a way that I had learned to expect that I might encounter some pushback or some microaggressions, as I traveled along the way. So certainly no shock. And it's sad to say that I just have kind of learned to live and adapt in that way. And my mother always taught me, treat everyone with kindness and you can kill more bees with honey, to be extra sweet, especially when people are being, aggressive or discriminatory toward you. So I would have to say that in nursing, there certainly wasn't a shock. I was fortunate to start my career at ECMC, which is or at least at the time was a very diverse hospital, and didn't really recognize the overt racism until I started my management career at Millard Fillmore Suburban, which, from anyone who's around here knows that is not a very diverse area. And the patients and the looks from the doctors, it was eye-opening when I would go to handle an issue or a concern or even responding to an emergency event. like hearing, we need a nurse, we need the manager here, and trying to explain that I'm the manager, I'm here to help them. And just the total disbelief was something that, I had to just learn to deal with and learn to overcome, and to walk away with that with my integrity and my self-esteem intact, and never stoop to the level of disrespect that I had received.
Me personally, when I started out as like an LPN. I was an aide before that, but as an LPN, I worked in assisted living. I would go to patients' rooms and I would have their meds for them, and then I would get to the room and they would say, "Oh, honey, no, I need the nurse." And no disrespect to the aides or anything. I love my aides. Like, those are the best people to work with. Those are like your backbone. So no disrespect to them, but I did work hard to get to where I am, and being a male and also African American, like a lot of people may have like different views as far as like what they're used to seeing, who they're used to seeing as nurses. So that might have been some of the first times I experienced some things.
Thank you all for sharing those moments.
May I jump in here? Sorry. Hi, my name is Dr. Bemenu. I am faculty at the School of Nursing. I am the only Black faculty at the School of Nursing right now. And I'm not part of the panel. That was intentional. We wanted to shift attention to people who are more clinical. But I think about, my journey. So I grew up in Kenya, and maybe you can hear an accent. And that combined with being Black was just not a good combination, because patients would say things to me like, "Oh, are you the nurse? Oh, where did you go to nursing school? Oh, are you sure you have a degree?" And all sorts of things like that. But I would say I've always been a very confident person, so I let a lot of those things just, roll off my back. I started off as a CNA, and Shadivia and I actually met way back when we worked as CNAs. So I've been a nurse 17 years now, 16. And I became a nurse very young. I was 21 when I got my RN. And again, the combination of not being American and being Black and being very young and being in a position of management, of leadership, it did not seem to be a good combination. It just did not go over well with a lot of people. Why should we listen to her, this young Black woman who has an accent? Why should we do this? But then again, like I said, I have always been a very confident person, and I let things roll off my back. But that's my story, for now.
Thank you so much for sharing that with us. Now I just want to kind of jump into some of the questions that were submitted ahead of time. To begin, how do you think universities like UB can be more intentional in creating access and representation within the School of Nursing?
I think we have to be supportive. You mean like go out and to recruit students, more minority students?
I think overall, so how can the school have a better representation and access to perhaps mentors like we're doing here today?
I think making a presence in the high schools as well, because when I went to Bennett High School, and the only thing that was really suggested to me was that I go into the service, in which I did go into the service. But I think they have all types of career fairs and stuff like that for high school students. And I think going into the inner city and letting the students know that they can do it is possible. There are support systems in place, and then just encouraging, because they may not feel like they can go to college or make it. I did go to Canisius very briefly, and I honestly feel like I did not get a very good education within the city of Buffalo and at been in high school. I feel like I was pretty much behind all my fellow students in that first semester.
I think one of the first things, and that's with any problem, is to admit that there is a problem. And I think being cognizant of the fact that there is not enough diversity within the School of Nursing at UB is definitely the first step. And then being proactive to change it, starting with forums like this. And the other thing is going to where the Black nurses are, or just nurses of diversity may be. Because when you do things like go to schools or go to areas that are, predominantly white, you're just like excluding a bunch of people. But partnerships with organizations like Black Nurses Rock, and any of the Divine Nine, any of the major organizations where there are a strong Black presence of professionals. I know we don't really have any HBCUs like here in upstate New York especially, but they're in this country, and developing a partnership with those organizations and those schools can help bring some of those nurses and professionals who have the degrees that are necessary to this area.
I like to piggyback off of what Willa suggested in starting in the high schools, really going to those communities where there are predominantly Black students and starting them right from the start, creating some sort of program where they have they come equipped and once they graduate to be successful in nursing school. I know I have a daughter who is interested in nursing, who's in her senior year, and had I not been a nurse, I don't know that she would have gotten the background that she needed, because the counselors, I don't know if they don't know or if, they're unaware, but I had to say, hey, why isn't she in chemistry? Like, she needs that for nursing school. And it just seemed like those sorts of things kind of slip through the cracks, and how we prepare our children is really important to kind of set them up for success. So having a big university going out and starting to build partnerships with the high school so that these children graduate prepared is probably step number one in getting the diversity into the school.
That's true.
I also think that that is a big part. Like I went to Bennett as well. I graduated in 2010, and we didn't have anybody who came to talk to us about nursing or anything because it's a law school. But there also wasn't like any high school where like any professionals came in and talked to us about like nursing at all. So I think that the high school students should see like other students that are diverse, and they should come talk to them and maybe mentor them, or let them know that there's more out here than just sports. I played basketball in high school, but I use basketball as for like a lot of analogies, to help me like get through nursing and everything. Like if you could play basketball, you could relate that to any subject at all. So maybe just talking to the kids, letting them know that they could do anything,
Thank you all. Those are all great points. The next question we have is, what is your advice for people of color who are experiencing imposter syndrome while navigating nursing?
Imposter syndrome?
Yeah, sorry. So imposter syndrome is oftentimes used to express when you feel inadequate, even though you very evidently have the information in the experience.
You really have to know yourself, be fully aware of your environment, and be confident, because from my experience, you get so many negative comments and such bad treatment more often than not. There's rarely ever anyone that looks like you, or me, I should say, in those environments. Many times I am the only Black nurse. I worked for the state. I worked for the DDSO. There were 300 nurses. I was the only Black one. So you have to be confident in who you are, because you're going to get that pushback. They will not embrace or respect your opinion, but you still have to maintain yourself and your integrity, and really try to not take it personally, because once you start to really embrace that, you start to feel that, and that will affect how you move forward going on, and you don't want to do that. So you really just have to know who you are and be confident.
I think mentorship is also very important, having a mentor, and not necessarily just a mentor that looks like you. I'm a firm believer in having mentors that are diverse, because each one will give you a different perspective. And I think really and truly relying on your mentors and identifying your allies, so that you can keep that confidence up, especially when you're new. When you're a new nurse, it is very difficult to walk in to that situation with confidence, because you're learning. So to just hear the stories of others, and to have someone who's able to encourage you and be candid with you and help you understand that this is a learning process and it's okay to feel uncomfortable, but you can do this, is truly, truly important. Without that, it's very, very easy to get discouraged or to feel like you don't, meet the standard, because in many ways you're hearing that over and over again in your daily work. So just making sure that you have those folks and you've identified those folks who are going to be your ally, going to be your mentor, and help you through that process until you can, say confidently that you are doing what you need to do as a nurse.
I think that organizations like Black Nurses Rock is a very good support system. You can go to this organization when we have our meetings, and we share and we discuss what we go through, and we continue to encourage each other. It is difficult being out there, and I understand being the only Black. I'm most often the only Black, even at conferences. Even going to a facility when you're an only Black and not being respected for what you earned, what you went to school for, and not being respected for that. So definitely joining organizations can help as far as the support system. And yes, mentoring is also great. And I really just think it starts from the top. It's a systemic problem. And you can do these things, but we really need help from top people so that it can trigger down, because it's a systemic problem, and that needs to be corrected before overall improvement can occur.
Absolutely. Thank you all for those points. The next question that we have is, have you noticed a change in how Black nurses are received and or perceived since you've started in the field?
Are they asking, has it gotten any better? Is that the point of the question?
Yes.
I would imagine so, yes.
It is, okay. From my experience, I think it just depends on where I land, where I end up working. My current position is I'm more well received, which I've never experienced before. So it's actually really nice because I've never really had that experience. I've had other positions where, being the only Black person and the person that was my mentor was white and was very supportive and was an advocate for me, fought some battles and put out fires for me. So that was helpful. So I think it just depends on that person's experience. I don't know if it's a change. I don't know if it's actually gotten any better.
I agree with Sophia wholeheartedly, because it's not so much of it's the nursing field as a whole as it is where you particularly are. And that's why it's important that you do your due diligence as to where you go to work, because you can walk into a place because they pay well, but that doesn't mean they're going to treat you well. You can walk into a place that'll hire you. And I think one of the things, if you haven't noticed, pretty much all of us are seeing is that tokenism is real. And we've definitely been a part of that throughout our careers, and that is very exhausting. And a lot of times that indicates how you will be treated, most certainly. If you are just, being brought in because we need someone to check off a box versus you're being hired here today because we are impressed with your resume has a big difference on how you will be treated.
Very true.
I would say that opportunities to see folks that look like me probably have increased, at least since I started out in nursing. I do see more faces of color, but to that point, you have to be very careful when you are starting your career that you are picking a place that you work for that really truly has an appreciation for diversity and inclusion, because you will be faced with racism no matter where you work. It is a fact of life. However, having the support from your employer, it truly makes a difference. To be faced with racism and feeling like you have no support and feeling isolated is one thing. To be faced with racism and feeling that you have your employer there to help back you up is another situation. So especially when it comes to growth and development and opportunities, you want to make sure that wherever you're working, you have that ally who's going to help push you and help get you to where you need to be. That person who behind closed doors is going to kind of speak well of you. You want to make sure that you're putting yourself in a position where you have those opportunities and not settle for a place just because it's a job.
So just to piggyback off of like what everybody else said, I'm not sure like if it has gotten like any better or or worse. I've only been like an RN for 2 years, so just over that period of time, I really wouldn't see like any change. But I do think the big thing is support, like having a diversity and inclusion program. That's pretty much it. And then also it does depend on like where you work at, like your location, where you're going to work at.
Thank you all. So the next question we have from the audience is, how do we address microaggressions from staff and patients in a respectful way that plants a seed for change and improvement?
I'd have to say you have to pick your battles, and I know that probably is not the most popular answer. However, I know, especially in hospitals, patients are considered customers, and it's very difficult to address something where you are the with a customer. However, it's very important that, again, where you're working, that they are able and willing to address that kind of on your behalf. I can remember a situation where I walked into a room and a patient mentioned that they didn't want me taking care of them specifically because I was Black. And my manager at the time, pulled me out of the room, got a new nurse for the assignment, and that was the end of it. And I walked away kind of feeling to myself like, okay, that was probably the best thing to do, but should this have been addressed in another way? Should something have been said to the patient where it might not have been my place to do that because it would have led to a confrontation? Certainly, I would have hoped that someone would have gone in and said, hey, that's not how we work here. We are an inclusive environment and we're not going to tolerate you treating our workers that way. That would have probably just made me feel better. Let's just face it. So I just really feel that microaggressions with, a coworker is maybe a little different than a microaggression with a patient. And if you're experiencing that with a coworker, then I think that you should respectfully address it. And address it by, I'm not certain what you meant by this. However, this is how it made me feel, or this is how it was perceived by me. And I didn't like that feeling, or it made me feel uncomfortable. And kind of see where they are from there. Depending on their response, maybe it was just one of those things that, they didn't understand or were unaware of, or maybe it's deeper than that. But I certainly think that you should try to address it, especially when you're dealing with a coworker or, someone that you're working with.
I agree with Tineka in the sense that, it's definitely much more difficult when you're talking about a patient. Versus when you're talking about your coworkers. And again, going back to pick and choose where you work. And you need that support from your employers, because as she said, like, she would have liked for her manager to have handled that a little bit differently and a little bit more supportive of her. But one of the things that I absolutely enjoy in my role at Travelers is that I'm one of the leaders in our Black and African American diversity network. And one of the things I do is I no longer cover. And in case you don't know, like, cover is when you're one way at work and you're a different way when you're comfortable within your own skin and within people and around people who look more like you. So I bring my whole self to work every day. And I do that because I can, you know. And so if someone does something as far as like a microaggression towards me, I call it out. I call it out clear, plain as day, and let them know what they did wrong and why they did it was wrong. And one of the main reasons why I do that is so that the next young Black girl who gets hired, who doesn't realize that she can do that, will be able to. And she doesn't have to experience what I did. So it's a part of like opening up the doorway and just making it easier for someone behind me. You know, I can wear my big, you know, bamboo earrings to work and no one's going to say anything to me because of the role that I have. But yeah, I have diamonds, I have pearls, but I feel like wearing that day. And I do it so that someone who doesn't have the option won't get looked at negatively, so that she can bring her whole self to work and just do her job and not be worried about what people think of her as far as her appearance, and not worrying about trying to cover, and just come in and do your job.
Yeah, it takes a little while to get to that point, though, too. You're exactly right. It takes a little while, though. I mean, I think it's a little bit tricky when you're working in a facility versus if you're, let's say, in home care or something like that. I had students when I worked for NCCC, and that exactly is what happened. This particular patient didn't want anybody Black, not a Black student, not a Black nurse, not a Black physician, refused everyone. And they permitted that, and the students were very upset about that, you know. And so trying to explain to them that this is what happens. And unfortunately, that particular organization did not support those nurses on the floor. And the nurse manager happened to be a Black woman, did not support them at all. And on the flip side, when I was in a Lovejoy area as a home care nurse, I would experience, you know, they would, you know, be very hostile, would kind of stare at me out the door like, are you really the nurse? I would have to show my badge up to the window so they can really see it. They would let me in, still very hostile, but by the time I finish being the professional that I am, they were okay. And then they were apologizing to me as they walked me to the door. So it's just, that's where that confidence come in, but it takes a little while to learn how to just not cover anymore. You just go in, you do your job as a professional, and just know that this is what's going to happen, and you have to kind of feel your way through as how you're going to handle it, because I will call someone out. And then they're a little flustered and say, oh, I'm so sorry, I didn't mean that. Of course you did, but we're just going to get through this anyway because I'm here to do a job. So hopefully then the next person that come in, if they happen to be Black or Hispanic or otherwise, won't have that same experience, because now they know that they need to make an adjustment.
I have to say that I agree with Tineka as far as where you work. I sort of left, and I've done long-term care for over 20 years, and that's where my passion is geriatrics. But I actually left a building because I just could not work with the physician any longer. And I felt like I didn't have support of the administration at that building. So it was just best for me just to move on. I actually changed my position to like just a wound care position. So I didn't have to really work with him so much. I just did wound care, and then I was out of the building. So I actually changed my place of work because I just couldn't take it anymore.
I agree with Sophia, just saying that you do have to address the microaggressions, just because they can just continue to build up, and eventually after a while it does take an emotional toll on you. So it is good to address the microaggressions and let them know what's going on, because, I mean, if you're the best at your job, you're the best at your job. You're there to give care, and that's pretty much it.
I think our next question is a good follow-up for what we just discussed, and that is, what do you do personally to take care of yourself when you do encounter pushback? Do you have a therapist? Do you have a good support system at work, or only outside of work?
I think as nurses, we meet people on the job and things like that, or in different organizations. And so, most of my friends are nurses. And so I may call them and vent, go for a walk to clear my head. I may write down the situation, how can I have done this better or handled this better? I do a self-checkup to see, is it something going on with me? Did I do something? Did I present something in a certain type of way that may have offended them? All of that. I go through all of that, and I still do. I don't internalize it, however, because I understand, because I've been in nursing since 1992, and I've learned some things in that time frame, and to not take it home and take it out on the people that's in the house with me. You can't do that, because they don't understand what you're going through when you go to work. So it's just trying to find something that is your release, whether it's venting to someone, writing it down, going for a walk. I took up kickboxing and like to kick the crap out of the long bag, or whatever the bag is called that you punch and everything. So whatever it is, to get that release out, so that you don't take that stuff home and take it out on someone who doesn't deserve it.
Yeah, I as the only Black person on my team, when I experience stuff, I might run down to Tineka's desk to tell her what just happened. But if she's not there or something like that, one of the things I do, and this is for any type of conflict you have in your life, don't ever take it personally. When the uglier people are to you is a true reflection of who they are and not you. And I just hold on to that dearly. And if I have to hold on to that until I make it home and get to staging and just get to meditating and prayer and just let it go and move on with your day, because again, it's not a reflection of you whatsoever. Don't ever internalize it. And I know that's easier to say than it is to do, especially because, like Sophia said earlier, it takes a while to get to that point. And you got to kind of go through some rough patches for it to start being a little bit smoother. But it'll be easier for you if you just don't internalize that. Don't hold on dearly to what other people say and how other people behave. Hold on to whom you actually are. And that's the most important self-care advice anyone can ever give you. Love yourself.
That's very true. Love yourself and believe in yourself, because it's very easy to fall into, this kind of slippery slope that you're hearing negative things or witnessing, negative acts toward you, and to then begin to start to feel defeated, especially when you are the only. So I really try to surround myself and identify what I like to call a board of directors in any place that I'm working. And I have, my sponsor, I have my mentor, I have my ally, and identify people who I can go to when I'm feeling that either I need to vent, talk, or check myself. Sometimes I'm like, am I being sensitive, or did this really happen? Did I interpret this correctly? Because it's very easy to kind of feel that, maybe you're being sensitive, somehow it's you. But typically, if you're feeling a certain type of way about how someone has responded to you, there's something behind it. So just having that confidence and having that, those go-to people to kind of help you save your mental health.
Right.
It definitely makes you second guess yourself, and I run things by my fellow colleagues just to see if it's me or is this really an issue. But for stress relief, I like to go work out or something like that. I used to take Taekwondo, and I used to just imagine punching somebody.
Right.
But some form of physical activity, you're doing something good for yourself, it's good for your body, and you're able to release natural endorphins, so it makes you feel better. But yeah, that's something you could do as well.
Yeah, kickboxing is amazing.
Yeah, I think the best thing is just not to internalize it. What I like to do is just to like go to the gym, get my mind off of things, or play basketball, listen to music, anything that pretty much help you get out of anything you got going on.
Cool. So the next question we have is, we discussed mentorship and why it's beneficial whether you have your associate's degree or your PhD. What are your thoughts on programs to also teach soft skills, self-care, and how to identify and mitigate effects of burnout so we can be the most present and handle racism in the workplace in the most professional way so that employers really have to go the distance to target you?
I would hope that formal mentorship programs have a component that teach those soft skills and how to address negative behavior. That is so very important, not just for your own self-care, but in order to help propel your career, it's very important that you have those soft skills. But those mentorship programs have to be intentional in making sure they're covering all the bases so that you have a professional component, an educational component, and those soft skills all kind of incorporated into that mentorship program, so you kind of come out with hitting every area.
Wonderful, thank you. So another question that we had was, what would you suggest to the School of Nursing on how to recruit more diverse nursing faculty?
I actually applied, but no one called me. I don't know. I'm not sure why I didn't get called, but and I think they have to make a presence. And again, going into the communities and maybe clinics and where these people are, where you can find practicing nurses out in the community working. Maybe you have to make more of an effort to get there. And I don't know, it's very tough. It's challenging trying to break through systems that are in place.
Well, I would have to say we all know that Buffalo is not the most diverse place in the world. So you definitely have to make sure that you're being intentional in your recruitment efforts and in your succession planning. So in your succession planning, who is that next person? Who's that next star that it could be the next, professor? And what are you doing to help support them and give them what they need to be successful? And that is not something that happens overnight. That is a long-term investment. Sometimes that might take years and years to get someone to that point, but you definitely have to make sure that you are being intentional. Otherwise, if you're just waiting for someone to apply, that may never happen. And part of the reason is kind of a slippery slope again, that you don't see anyone of color, in that position. So, maybe people might be discouraged and may think that they shouldn't apply because they're not going to be considered. So certainly being intentional.
And in addition to being intentional, I think recognizing that, like Tineka said, Buffalo is not the most diverse areas. And, we are like one of the, highest segregated areas and racial areas. So being aware of the hiring practices and the fact that, there are sometimes some unconscionable biases that are present. You might have to outsource a hiring organization so that you can bring in more diversity, because like Willa said, she applied, but no one ever got back to her. There may be some barriers there that just haven't been addressed, and people don't want to address it because it's uncomfortable. But maybe, you might have to outsource who actually does the hiring for diversity and bring in that needed talent and maintain the ones that you actually do have.
I think similar to that question, another question from a faculty or staff member here at the School of Nursing was, as white faculty and nurses, what can we do to be better allies?
In general, at all times, in order for white people to be true allies, because that is a sticky word, you must and you have to use the privilege that you have for people who don't. And so that means you have to voice when you see something. You have to be cognizant that it may be present. You have to actively, physically go above and beyond in order to break down those barriers. So just asking, like, what could we do is the starting point, but then you have to do it. That means if you have to help costly run a panel speaking about racism in nursing, do that. That means if you have to incorporate some kind of mentorship program with Black nurses in the community for your students, that means you do that. That means you go to the head of whomever and you discuss that with them. You do the work. You do the outlines. You be the voice that doesn't necessarily get listened to when it's coming from someone of color. That's an ally.
Yeah, and I think when you see and hear your fellow colleagues as faculty members, or if you hear another student say something that could be racially biased or something, you need to speak out, bring it to the forefront. I think, and I don't know, I like to give people the benefit of the doubt, but maybe they don't realize that they're saying something that's hurtful or harmful to that person. People joke around and not realize that they're hurting someone else's feelings. So yeah, I think, call them to the carpet and just, address it right there and there, right then and there.
So I think one of the problems of being in any sort of area that lacks diversity is that you do not have the diverse opinions and thoughts of people from diverse backgrounds. So being an ally is really kind of understanding and being the voice of the people who are not in the room. I know we've had recent episodes of different companies who have marketed things that were not racially conscious at all. And it just kind of makes you wonder, like, who was in that room that they allowed this to be released and no one said anything? So to be able to have that understanding and to be that voice in the room when other people are not represented is what you can do to be an ally. But first you have to understand what that voice would say.
The next question we have, oh, I'm so sorry, did I cut someone off? Okay. The next question that we have is a two-part question. So the first is, what racial disparities have you seen in patient healthcare and how do you think it should be addressed? And the second part to that is, what do you think new nurses need to do to prevent health disparities while caring for patients?
I think that health disparities, your chronic medical problems, normally African Americans present with a more severe case or more complications, more advanced stages, and I mean, I know that's due to a lot of reasons, but I think teaching and new nurses, and especially African American, you can probably relate and talk in a certain way where they will understand. Like, just break it down and teach them about, you're diabetic, this is what you got to do. You have congestive heart failure, leave the pork rinds alone. But I think education is definitely what we need to help with the health disparities that we have. Because we get our our patients way advanced in disease stages, and it shouldn't be, especially when they have primary care physicians. They see.
And not make assumptions. Really and truly, I know sometimes people come with levels out of control, and you just kind of wonder, well, how did it get this way? You know, why you didn't take your medicine? Don't label them as non-compliant. You really need to dig in and understand, why didn't they take their medicine? Do they have access to medicine? Are they unable to afford it? Making those assumptions, I think, have really truly put people at a disadvantage, because I don't think that everyone takes the time to kind of drill down to what the true problem is, and sometimes people just assume they're non-compliant, this is what they're going to be, and move on with it. And I think that has a lot to do with some of the racial disparities in healthcare.
And the other thing is just knowing history and being cognizant of that as well, because, I mean, there are a lot of Black people and definitely in the elderly population that truly mistrust the government of the United States and have every right to. We look back on things like the Tuskegee experiment, and then even now, and you can see it today when people are talking about taking a vaccine for COVID, it's more Black people saying, wait a minute, than it is anyone else, because we've been there, done that. And it didn't turn out well for us. And so just being aware that sometimes, like when someone is presented, like Tineka said, with these high levels, and it seems like they may be non-compliant, that there may be something at the root of that, like fear of their doctors, fear of what's going to be their actual outcome if they take this pill that they don't know anything about, or if they, don't do something that they've normally been doing. They think that, like, some medical professionals might be out to hurt them more than help them. And as far as like new nurses and how they can help, is to just listen and to not be judgmental, not jump to conclusions, and to come in with an open heart and an open mind to all your patients, to everyone like they're human beings.
Thank you all. I am noticing now that we are just closing up on our hour point, but before I hand this over to Amy, I just wanted to ask if anyone had any last thoughts that they wanted to share.
Thank you to all our panelists for taking the time out of their day to come here. I really do appreciate it. I think a lot of people here appreciate you guys as well.
Yeah, thank you so much. This has been like a huge therapy session for me. Yeah, so thank you.
My pleasure.
Okay, maybe I'll just jump in. I want to say thank you so much. I mean, as a white woman who's the chair of the Diversity and Inclusion Committee, I have so much to learn, and I learned a lot tonight, and I know it's just like a tiny step towards what we need to do, and I just am so thankful for all of you for taking the time, because it took a lot of prep and a lot of thought and a lot of caring to come here tonight, so I appreciate that. And I'm really thrilled that we had so many in attendance. I think we had up to 61, and there were 100 people that registered. And so I'm, excited that we'll be able to send out the recording to those folks who couldn't make it here tonight, and they'll be able to listen to it later. And I really think that the high attendance rate, I see it really symbolically, like, everyone's dedication to improving the culture of the School of Nursing. And so I'm so thankful of that. So, and also thank you to everyone that posed questions, because today wouldn't have been possible without those great questions. I wanted to say that we will be sending out an email. I know we had a question in the chat about sharing contact information. We're going to be sending out an email following the event, and that's going to contain a bunch of different points. As I noted, we're recording the event, and that'll be made available to everyone. And also the recording is going to be available in the Gamma Kappa chapter repository, as Grace mentioned at the beginning. And we're going to include the contact information for our panelists in that email in case you want to reach out to them directly. We also are going to include a brief survey to assess your perceptions about the event. And I really encourage you to complete that, because it's going to give us some really important feedback that will help us make future decisions about, programming in our school. And I also wanted to take a moment, Dean Lewis, I believe, is still on the call here tonight. I wanted to report that I'm really excited that Dean Lewis and our partner Roy have generously donated funds to help us establish a new and dedicated diversity and inclusion fund. We're calling it the Sun Jedi Fund, which I think is a cool name. Jedi stands for Justice, Equity, Diversity, and Inclusion. And these funds are going to be able to use to support our efforts to host a variety of events that we're going to be used to target students, faculty, and staff. And we've already gotten a lot of ideas over the summer during conversations with faculty, staff, and students. However, I really want to encourage all of you to pass along your ideas. Please let us know if you have specific workshops, trainings, events, speakers, so on, that you'd like to see on our Sun calendar this year. And we'll provide contact information in the follow-up email so that you can share your suggestions. And we're also going to provide more information at a future date if you want to make donations to the fund. We're kind of wrapping up the details of that, but it's going to be completed real soon. So having said that, unless anybody has any questions about that, I just want to thank everyone for joining us, and it was a really fabulous conversation.
Thank you for having us.
Thank you.
Yeah.
Thank you very much to the panelists for sharing your time and your stories.
Thank you. You're very welcome.
Thank you for having us.
Thank you.
Thank you.
Good night, everyone.
Thank you for what you guys are doing for the students, too. As we were saying in one of the prep meetings, I wish I had something like this when I was in nursing school. I think it's going to make a big difference for them. I do.
Oh, good. I'm so glad to hear that, because that's the whole goal, and it wouldn't be possible without you.
I agree. I feel like you guys are like the family member or friend that I've never really had, and I finally have gotten like these words of reassurance.
For the aunties.
Yes.
Right.
He's an uncle.
Right. Just know that you can do this. It's not going to be easy. We're not going to sugarcoat it for you, but you can absolutely do this. You have spoken to 4 women and 1 male that is making it and has made it through. You can definitely do it. So no matter what is said to you or done to you at work, you can still make it.
Thank you.
We know that. All right. Bye, everyone.
Bye-bye.
Thank you. Bye-bye.
Thank you.